California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Hi, welcome to California Pediatrics. And today I have Dr. Joe Cox with us from CalMap. Welcome, Joe.
Hey, Melissa. Thanks for having me. It's great to be here.
Yeah. And so I'd love to start out with, I know what CalMap is, but I'd love to start out with what is CalMap? And, let's let everyone know this incredible service we have here in California.
Yeah, great. Yeah, it's a relatively kind of newer program, so it's a lot of folks haven't heard about it yet, but it stands for California Child Adolescent Mental Health Access Portal, and it is a pediatric mental health care access program. And it's modeled after programs now in 50 out of 50 states have similar statewide programs. And the idea is to step into the gap where there's not enough mental health clinicians and primary care physicians and providers like pediatricians are being asked to do a lot of mental health care. And we want to support them to provide good quality mental health care and increase access for their patients to mental health care. We know that it takes a long time to get to see a mental health clinician sometimes. And also there's a lot of great things about getting good mental health care from your pediatrician, like the trust that you have with them, the rapport, you know them so well. Pediatricians are great at prevention. It can catch things early if they're looking out for them. And it's a lot less stigma about talking to your primary care physician versus going to a mental health clinician sometimes. So it really increases access. And especially, a really important point is that it increases access for the folks who need it the most, like, really underserved populations in rural areas and even urban areas where people are no insurance or don't have really good coverage with their insurance. They have access then to mental health care through these programs. So it's a free program. I always forget to say that, but it's free. It's state funded and federally funded. And I can talk to you more about what actually it means. What does mental health care access mean? But that's kind of the broad scope of what our mission is to support pediatricians, primary care providers in providing mental health care for their patients and families.
Yeah, it's been really incredible. And, I know we had you come talk to our residents during the didactics to really start, getting the word out. I think we have used it in our office. And so we'll talk maybe about the psych component in terms of being able to consult a child psychiatrist. What does that look like? So, if I'm struggling with maybe transitioning a child off one SSRI to another, maybe if I'm looking at a different stimulant medication, I'm having too many side effects with one or the other. What are some other kind of calls you guys get?
Yeah, so you mentioned the calling part, and that is a big part of the program. There's really 3. I'll kind of take one step back and talk about there's 3 main kind of components of CalMap and other pediatric mental health care access programs. And one is the real-time, like, curbside consultation with a mental health clinician, and that's often a child psychiatrist. So we have child psychiatrists available for calling, and we'll talk about other ways of consulting, but talking to a child psychiatrist for a primary care provider in California, Monday through Friday, 8:30 to 5 p.m. And you can just either call or place a consult request through our website to have it call back in 5 to 10 minutes, like as soon as possible. Or you can schedule a time for us to call you if there's a time you'll be charting or anything like that is easier for you to talk to somebody. The calls can last from like 2 minutes to 30 minutes to longer, depending on what's going on. So we know time is a major barrier. But just know that it doesn't have to take all that long. We can talk really quickly and answer a quick question. So That is through, that's the phone consultation part. We also have e-consultation now. That's a newer part of the program. So for the folks who maybe have, a quicker question, or maybe they don't have time to call and they're charting after hours or something like that, if you want to do an e-consult where you just type out a question through the website and it goes to one of our child psychiatrists, and then we get back to you within 24 hours with
Oh, wow.
recommendations. And the phone consults too, we write out the recommendations, send those to you within 24 hours. Then you have it in writing, and you can, put it in the chart and whatnot. So that's the phone consultation. And it's not just child psychiatrists for CalMAP as well. We have child psychologists too that are available for consultation, either phone or e-consults, with, areas of expertise that are really helpful. Even, for us, there's a Evan Holloway who specializes in youth substance use.
Oh,
We have a psychologist who specializes in eating disorders, autism, and early childhood. So if you have more questions around like behavioral management or how to do quick interventions in a primary care setting, you can ask for a consult with a child psychologist. They're not available as all the time like the psychiatrists are. They have specific times that they're available, but that's also an option. And then, and so that's one big part, and that is a big part. And we talk about things like medication management, like you mentioned. Oftentimes, that's part of the questions, especially to the child psychiatrists. But really, very frequently, we go back to what is the diagnosis, what's really going on with this family, considering things like social determinants and
yeah.
social factors and stressors, making sure we're not missing something, and
Trauma.
giving, yeah, trauma. I mean, considering like, what else could be going on, because we know that, we have to have that right before we can have a really good treatment plan in place. So we talk about diagnoses, we talk about medications, we talk about other mental health resources, how to get connected to those. And that's a good segue into another big part of our program is you got consultation and then care coordination. So the
Right.
care coordination part, we have a team of licensed clinical social workers who have done an incredible job of looking at all throughout California and mapping resources in various regions for different kinds of things, like different kinds of therapy for different kinds, kids, like of different age
Yeah.
groups, and they're experts at how to navigate systems like the school system and the regional center and insurance, coverage to help families get connected to the resources that,
Mm.
they need. So oftentimes, probably about half of our consults at this point are for care coordination, where a
Right.
pediatrician or a PCP knows what they want, but it's how to get the family to that
Right.
resource.
Well, very few clinics have social workers, right? Very few offices have social workers. So that care coordination piece is so critical. And I know when I moved like cities, that makes a huge difference. Like all of a sudden, I didn't know where to send patients, and I didn't have a social worker. And so I've definitely been using the care coordination piece. I think the other thing, and correct me if I'm wrong, that they'll help, they kind of like follow up and make sure that families actually got connected, right? So it's not just that necessarily handing someone like a sheet of paper with some.
Paper. Yeah. Yeah, that's right. So that's the really helpful thing about the care coordination part is first, if you kind of want a list of things, they'll do
Sure.
a list and they'll do an e-consult. They can do it by phone or e-consult, and they'll give you a list of things if haven't tried, or what are the first steps of applying to the regional center. They can tell you that, and you can pass that along to a family. But when there's multiple barriers, which is oftentimes the case, whether it's language, financial, severity of illness, they will it's they decide and talk with you about it, but and with the family's permission, will oftentimes do a direct to family consult. So that's where they can call the family and basically hold their hand with help them get connected to the resources that they need. So and they'll follow up every week for a few weeks or until they get connected. So it could be getting an appointment with a psychiatrist because, sometimes they need that level of care, or
Right.
getting an application into the regional center, or getting an IEP letter written and turned into school. So they'll do that level of support. And yeah, even places with social workers. We've had care
Right.
coordination consults where it's just hard to do depending on how many clients or the
Hmm.
patients they're having to support. So yeah, that's the care coordination piece. And as I said, so when you request a consult, you can request it just for care coordination. If you don't have a question
Right.
for psychiatry, you can say, I'd like to talk to the care coordinator. They talk to you, they decide, do we need to reach out to the family or not? Um, and you will schedule a time with the care coordinator. They're also available Monday through Friday, 8:30 to 5. But the time is usually scheduled rather than just call me back ASAP,
Sure.
although they can call back really quickly. So yeah, so that I think is just, yeah, yeah, I tend to think more valuable than talking to me, but it's huge. I've had some of my patients even where I'm having trouble getting them connected, and I reach out to their PCP and say, "Hey, can you place a
Can
CalMac
you put
care
a consult
coordinator?
in?
Yes, for me to because I'm not a PCP, so
Right, right.
technically, even though I'll reach out to them on the side as well. But yeah, they do an amazing job and just wonderful people. They use translators when necessary, and some speak multiple languages too. So
Right.
yeah, I can't speak highly enough of them.
And I have residents working with you and a lot of your colleagues. I'd love to hear kind of what that experience has looked like and what the role of CalMAP is and maybe will be in kind of mental health training for
Yeah,
patients.
thanks, Melissa. Yeah, it's something I'm just really passionate about is the mental health education for folks in training, especially folks. I mean, and a lot of our residents are not going on to be primary care physicians, are going on to subspecialty things, but really all of them are going to encounter mental health issues wherever they end up. And yeah, what resources they have depends on where they've settled down, and it's all different things. So yeah, I think I'm also someone that really believes in early intervention as well. So I kind of subspecialize in early childhood psychiatry, and because I like to see if we can get in as early as possible and help with training. So that's where kind of this comes from, and this is such a unique opportunity with the mental health rotation requirement that everyone's scrambling to figure out what we can do to fill this time and how we can build it because we're not given any guidance about what it should look like,
Yeah.
right, by ACGME or anybody else. So there's some really good resources out there like the Empower curriculum from
Yes.
APPD,
Excellent.
and there's excellent kind of curricular stuff, but we're also looking for things like if you look at the American Board of Pediatrics now, the EPA 4, the mental health EPA, there's one line about taking care of medications, really, I think, and all the other stuff, it's about collaborating with other providers. It's about like utilizing available mental health resources. It's about shared decision making and how to talk to families about complex issues. So there's a lot of components that we want in providing mental health care that we want residents to be able to do by the end of their training.
Right.
And we know from surveys that they're really not there. We have a lot of room to grow. So I've just been, reaching out to training programs across the state. There's 18 pediatric, residencies in California, and they're all trying to create mental health rotations and trying to see how CalMAP can support them in doing that. And so some of the ways we've done that is just have a conversation, like just do a presentation about CalMAP to the residents, coming to a noon conference or a didactic time and just talking to them about it, either me or one of my colleagues or one of the care coordinators too to talk about that component.
And having
Um,
them register. I remember
exactly.
like register right in here right now.
Exactly. So we're able to do group registrations as well of the whole roster of residents. And that's what we've done with some programs too, where we get basically, what the NPI is and we can just get them all registered. So that way they're just that step is already done for them. And, they get our kind of biweekly emails and updates about the program. So that's one way. And then, we're trying to see how we're trying to get creative and how else we can support it. And one of the things I think the barriers of using CalMAP is just not being so familiar with it or seeing it in action. So we've kind of been piloting this with your program, with Cottage, and a few others where residents will kind of come in small groups with me or one of our other consultants talk about CalMap, learn about it as a resource, really, the details, kind of what we're doing here, and then try to at least go through, either see it in action and observe kind of a consult with permission of the PCP and everything being de-identified, or go through an old consult so that they get a sense of, this is what it looks like, this is what people call about, this is how I use it. And I think hopefully that, plus getting them registered, plus them knowing about it, lowers that barrier for them using it in the future. And at the same time, there's a lot of mental health education, as I mentioned. Like, we get off topic on, things like other mental health resources, the regional center. We talk about, yesterday we were talking about medications for sleep and medications for autism. So, we, discuss a lot of mental health topics in these sessions as well. So we're just trying to look for as many ways as we can to support residents. And at the same time, we have to support the faculty too, because we know that that's who they're learning from. That's who they're, with every day. So that's what we're trying to do, as well as reaching out to faculty, getting them registered, letting them know about CalMap so that they can, feel comfortable and supported and doing mental health care, and that their residents can learn from them.
Right, absolutely. And I've only heard positive feedback, by the way. They really enjoy those sessions. I think they get a lot out of them. And, I didn't know how it would turn out because they're virtual for us. And I think it's just been very valuable. So we really appreciate the support in training our residents. And I think it's been really great. And I think that, and I know that you are passionate about it. That shows. And I think potentially integrating it into other programs could be a really great thing. I did want to, just finish off talking about the faculty training and faculty development. We want to definitely talk about the mental health boot camp that is happening on Friday, February 27th at CHLA. I'm going. A number of my residents are going. Do you want to talk a little bit about that?
Yeah, of course. So that is the third kind of leg of the stool, with care coordination, with consultation, and then educational offerings. That's the other part of these PMHCA mental health care access programs. Is, again, at the core of our mission is education. So we're trying to think of creative ways we can do that. We have monthly webinars every first Friday on basic mental health care topics in primary care, and some complicated ones too. Those are recorded and available for viewing afterwards as well. You can get free CME that way.
Awesome.
Then there's Project Echo things where you can do case-based discussions. Those are on the second Fridays at noon, and you can register for those. And then what we're trying to do too is have some in-person trainings, because we know that can be just to have some dedicated time to to doing, continuing medical education is helpful, and to see people in person. So we've been doing a few boot camps. We have that one coming up, this one coming up on February 27th, as you mentioned. It's from 8 to 5. You can register in links below and on the CalMap website and AP Chapter 2 website. We'll be covering topics. There's 3 modules covering topics about, first off, like basics of ADHD, anxiety, and depression, medication management, non-medication treatment strategies, then going to disruptive behaviors, more challenging things where there's complex, ADHD or ASD, and then finally ending with adolescent and youth risk-taking behaviors, things like substance use, non-suicidal self-injury, some challenging things. So it's hopefully it's going to be a great experience for you and residents. But this is where, this is the kind of stuff where we're trying to support the faculty in particular, but anybody's welcome to join and get free CME that way. So hope to see a lot of you there.
Yeah, it's incredible. It sounds like quite a boot camp, and I'm really looking forward to it. Thank you so much for this time and talking about this great work. I've definitely used it. My residents have learned to use it, and I think it's been so valuable to the kids we serve.
Thanks, Melissa. You've been an amazing champion, and appreciate your support. And great to be here. Thanks.